NBC5 Responds and a Hinsdale couple reached out to NBC5 Responds asking for help with a blunder by their insurance company.
We helped uncover a problem that could potentially impact other insured patients too. Here's Kate Chappell.
High school sweethearts Bill and Carol Seith have been married for more than 4 decades.
As a matter of fact, we're coming up on the 50th anniversary of our first date.
They raised their 2 boys in this Hinsdale home. In fact, it's the same house Bill grew up in.
After I graduated from law school, Carol and I bought the house for my dad.
They've celebrated many milestones here, including their 65th birthdays. That just so happens to be the age at which you become eligible for Medicare. But in Bill and Carol's case, they're not enrolled in Medicare. They're both still working and insured through Carol's employer. Shortly after their birthdays, and when Bill joined Carol's plan, their insurance company, United Healthcare, or UHC, started denying the Seiths' health insurance claims.
We began receiving denials of our medical claims, and the excuse was that Medicare was supposedly our primary insurer because we were now 65. But we didn't have Medicare.
And when you told them we don't have Medicare, what did they say?
They agreed. We see you don't have Medicare. We are listed as your primary. All we can do is reprocess your claims and see what happens.
But United Healthcare's fix only worked for a few of the claims, according to the Seiths.
And what we were ultimately told is that their software is not capable of having a switch that tells the system not to run it through Medicaid or Medicare first.
How much did these denials end up costing you?
Well, over the course of a year, they were going to cost well over $10,000.
One of the priciest bills, $2,600 for an emergency room visit out of state.
Well, I mean, $2,600, that's a lot.
That was a lot of money and pretty shocking.
After numerous calls and emails back and forth with UHC and no progress, the couple reached out to NBC5 Responds. Within 1 day of NBC Chicago's involvement, the Seiths say they got a call from UHC.
She apologized profusely. She said, "I'm the person you get when customer service drops the ball."
In a matter of days, the problem was resolved.
And it literally only took them 2 weeks after you helped us to file all of those claims again, to have them reprocessed properly.
UHC wouldn't elaborate on the Seiths' case, sending us a statement reading, "We are pleased we were able to resolve this unique administrative issue for Mr. and Mrs. Seith."
Without your help, I don't know that anybody can navigate that labyrinth. I mean, it's just crazy.
Under federal rules, if you're employed by a small business with fewer than 20 employees, when you turn 65, your health insurance will automatically switch over to Medicare. If your employer has 20 or more employees, your employer plan stays primary. In Carol's case, she says she works for a company that employs thousands of people. Kate Chappell, NBC5 Responds.
All right. Thank you, Kate. Thank you, Bill and Carol.
Glad they got that all straightened out. My goodness.